Good morning, everyone. My name is Isha Chitroda from MD4, and today I'm going to be presenting my GHSORP2. So this is the case that we have today. A 30-year-old man presents with abdominal pain, decreased appetite and fatigue. He has yellowing of his skin and urine. He has a history of sexually multiple partners, and he uses drugs intravenously, as well as he has tenderness in the right upper quadrant. And you can also see his bilirubin levels, his alkaline phosphatase, and aminotransferase levels as well. So here's how we can figure out what exactly he has. Before that, I just wanted to get it clear out that he has hepatitis B. Now we can figure out why from this table. So first of all, let's look at all of these individually. So antihepatitis A, IgM, and IgG are both negative. That means that this patient never had hepatitis B or doesn't have an ongoing infection. So let's go with hepatitis B core IgM, which is positive. That means that this is a acute infection because IgG is negative. That means it cannot be chronic. And then you have hepatitis B surface antigen positive, which could mean it's either acute or chronic, but as we already decided before, since the core IgM was positive, it's acute. Then the hepatitis B e antigen is also positive. That means it can either be during the window period or the resolved period. And then anti-hepatitis C antibody is negative. So yeah, as we discussed before, from the results, we know that this is hepatitis B, and the differential diagnosis can be autoimmune hepatitis, liver cirrhosis, hepatotoxicity, and other hepatitis. A, B, C, D, E. So hepatitis B comes in a class or family of virus called the virus. It is a partial double-stranded DNA, circular, and it's enveloped. So the transmission is from either sexual contact, from mother to child, from transplantation. Transplantation, sharing objects such as needle, razors, syringes, and also by blood, like blood transfusion and things like that. So let's look at the pathophysiology. So this virus uses the RNA polymerase to make new proteins from viral DNA. This viral DNA, or the progeny DNA, is the one that integrates into the host cell, and this is how there's the spread of the infection. So, this the hepatitis B virus affects the hepatocytes, and this is basically when the CD8 T cells attack the liver or the hepatocytes, which causes the damage of the liver. And this is okay. So you basically need a cell-mediated immune response, and it's very important for clearing the infection. There are two types of complications: acute and chronic. So acute, you have type 3 hypersensitivity, which is basically immune complex deposition, the HBsAg and HBsAg. It's going to rash, polyarthritis, fever, glomerulonephritis, and polyarteritis nodosa. And fulminant hepatitis, which is basically liver cirrhosis, ascites, or bleeding. And then in chronic, you have chronic hepatitis, which can be scarring of the liver, basically it can lead to cirrhosis, liver failure, primary hepatocellular carcinoma. How do we manage and prevent this disease? So there is no treatment for acute. You just have to take care and precautions. But for chronic, you have medicines such as tenofovir, entecavir, and lamivudine, which blocks the reverse transcriptase enzyme. And then you can also undergo liver transplantation. And then you also have pegylated tumor necrosis factor alpha A2 that can be given. For prevention, you have two types of vaccines. You have active recombinant vaccine, which basically you have to give 2 vaccines, in the first month, then you have to give the 3rd vaccine after the 6th month. It basically contains the antigen, the HBsAg antigen, and it's given to infants, adults with risk of this infection, um, or this virus, and then healthcare workers, people with HIV or other liver disease could, be exposed or could lead to having this disease. And then you have the second vaccine, which is passive active immunization. So it's vaccine plus the hepatitis B immunoglobulin, and it is basically for needle stick injuries for infant born to a hepatitis B positive mother and who has a positive HBsAg antigen. Um, and they should be given it within 12 hours of birth. Yeah. Thank you so much, and my resources are right here.